Welcome back, Dr. Ilana Gelman here, naturopathic doctor, and welcome back to my kitchen. I just spent all morning at the DMV. That is not a fun place to be. I got in my Pilates and my workout. I had to go to the DMV, and so I'm actually just so happy to be home to start meal prepping, make this video for you, and go on with my day because it's not so much fun at the DMV. And I am going to totally transform my day because there's a lot of great information to talk to you about, and this always fires me up, so I'm looking forward to sharing. Last week we started with nutrient dense carbohydrates, and I went over my top favorite choice, which are root vegetables. Your yams, your squashes, your beets, your carrots, those are just the most nutrient dense, and they stabilize your blood sugar the best that any of the options are. Now, there's other two choices that I like to share with my patients, and I want to share with you too. The second choice, which is a good choice, not an excellent choice, but a good choice, are your fruits. Now, fruits can be a variety of fruits. I use berries a lot, organic berries. Remember on the Dirty Dozen, I put these in my smoothies. We've got organic apples. You always want to buy organic. They're number one. Your citrus, they don't have to be organic. That's good. They're on the Clean 15. This is like my new favorite thing, are these crispy organic apple chips. I think they're a great snack for kids and adults to just dip in like almond butter. And then some goji berries. This is a superfood. Now, fruit can settle well with some people and it doesn't settle well with some. I have a lot of patients who have digestive problems, and they actually don't do well with fruit at all. Their blood sugar will spike with fruit, and sometimes they get a little lightheaded, sometimes they get digestive complaints, diarrhea, bloating. If any of these symptoms happen to you, you really do want to stay away from fruit. A lot of people that have candida don't do well with fruit at all, even the berries, so you really want to limit that. Start being more mindful of how your body reacts with fruit. I know for a number of years I didn't do well with fruit, and now I'm doing so much better that I can eat some fruit, and it's still pretty minimal, but the root vegetables definitely do the best for me. But there's some information on fruit. The top 4 fruit that I always recommend trying to stay away from are the most high glycemic sugar-dense fruits. That is your dates, grapes, watermelon, and banana. A lot of people eat bananas, so stay away from bananas if you feel like you've got an imbalanced sugar. Once again, you never want to eat your fruit alone because you want it to be in a balanced plate. That's going to be, you want protein, fat, vegetables with your nutrient-dense carbohydrate. So just eating grapefruit alone is just going to spike your blood sugar, and it's going to throw off your mood. It's going to throw off your hormones. It'll throw off your just rhythm in general, and you don't want that to happen. So you always want to eat it with some other food to balance your blood sugar out. So that's fruit, and that's my 2 cents with that. You really, really want to make sure you're eating it with other foods and to be balanced. Now, a lot of people say that it's best to eat fruit before a big meal. Otherwise, it'll ferment in your stomach if you eat it after a meal. And that could be a really good point and really good case for some people. Some it works really well with, and some others I don't see a difference with. So during my little investigation with some of my patients, I always ask, and some people have a problem with it and some people don't. So better yet, if you want to be safe, eat it before a meal versus after a meal so that you can digest your fruits easily. All right, the third and the final category of nutrient-dense carbohydrates are grains, and we want to eat them in whole grains. However, a lot of whole grains don't do well with a lot of my patients. So I've been seeing this over the years, and I'm noticing it, and this is why I've gotten so interested in the paleo diet. Now, some people on the paleo diet will still eat some rice, they'll still eat some quinoa. Many of them will not. They'll only eat root vegetables and the fruits, which is why those 2 categories are my top choices for nutrient-dense carbohydrates. Some of the grains that I choose to eat once in a while and I want to share with you that are more easily to digest are as follows. Quinoa. Quinoa is very quick to cook. It cooks in 15 minutes. However, although there are a lot of nutrients in quinoa, there are still some anti-nutrients in quinoa. What that means is that there are some nutrients in here that will actually bind to some of your minerals and actually excrete some of those minerals from your body in addition to supplying some minerals that are in the actual quinoa. Now, that's kind of like a risk-benefit kind of discussion you kind of have to have with yourself is it worth it to have this, or is it not worth it to have? Now for me, I don't really do all that well with grains. I tend to gain weight when I eat grains. I stay away from them. I feel really good the weight that I'm at. I feel really strong, and so I just have to listen to my body, and everyone's body is very different. I just do so well with my root vegetables and then some fruit here and there that the grains I really cook when somebody else is requesting that pretty much. So I do that for my partner. He really loves them. He's an athlete, and he really does well with the whole grain carbohydrates. Now, this is for the quinoa. Now, what you can do to get around the anti-nutrient properties is sprout your grains. Now, this is just like a product that is sprouted buckwheat and sprouted quinoa, along with this kind of granola. It's a sprouted buckwheat. And what they do with sprouting is you soak it and you allow the actual grain to, you can kind of say like uncover its anti-nutrient properties. It's the coating around the grain that is protecting the grain from the outside world that is actually the anti-nutrient properties. It's called phytic acid. There's some lectins in it that irritate the gut. There's a lot of biochemistry behind it, but I just want to give you an idea of what you want to try to stay away from. So if you see sprouted grains, that's a much, much better source of a nutrient-dense carbohydrate. Now, in addition, rice. You know, you always have like regular rice that you could just put in a pot, but what I also like are like spring rolls, like rice paper. I use these to wrap things in versus using bread or wheat. I always stay away from wheat and gluten. It does not settle with me. I just read Wheat Belly. There's an amazing amount of information. Maybe next video I'll actually talk all about why I avoid wheat and gluten. That would be an excellent video. But I'll use rice papers instead when I want to do that. Or my favorite are nori wraps. Forget about the burritos, forget about all of that. I use nori wraps to wrap turkey in, to wrap like a tuna salad or a wild salmon salad in, sardines. I mean, I use this almost every week, and I love it, and the people that I've turned it on to, they love it too. So I highly recommend you start trying this out as nori wraps. Also, like if I ever have to use like a wheat flour to bind something, like today I'm going to make bison meatballs, and sometimes it calls for like a wheat crumble or like a wheat breadcrumbs. Yeah, that's what I'm trying to say. I'll use coconut flour instead, or I'll use almond flour instead. There's so many substitutes that I don't need to use flour or wheat that's not a problem for me. So, to summarize, the nutrient-dense carbohydrates that will complete a meal are as follows. Your top most excellent choice, root vegetables. Your second choice that are a good choice are going to be your fruit. And your okay choice are going to be grains, and most recommended is going to be your sprouted and even fermented grains. That's going to be by far the most nutrient-dense that you can get. Okay, next video I'm going to talk about wheat and gluten and why it's so important to avoid those for many people. And then that'll wrap up that whole complete balanced meal. All right, gotta go start cooking. I'm already late for the day. Enjoy your week, enjoy your nutrient-dense carbohydrates, and I will see you next week with more information. Bye.